a #1 medical coding training academy, Thought Flows.
Good morning, ma'am.
Yes, good morning. Take your seat.
Thank you, ma'am.
So, hi Avanya.
Hi.
How are you?
Fine.
Okay, you can introduce yourself.
First of all, thank you, ma'am, for giving me this opportunity. My name is Avinya. I'm from Coimbatore, Sundarapuram. I completed my BDS, that is Bachelor of Dental Surgery, in Adiparashakti Dental College and Hospital in Medmarvattur, and I completed my internship in Sri Ramakrishna Dental College and Hospital in Coimbatore. I passed out in the year of 2019. I belong to a nuclear family. My dad got VRS, my mom is a homemaker, and my brother he's doing his BE final year Agri. And I completed my MCT, that is Medical Coding Training, in Thought Flows Academy, Coimbatore. And I also have a strong knowledge in the anatomy, physiology, pathology and medical terminology. I also have a quite good this in ICD, CPT and HCPCs.
What is medical coding?
Medical coding is the transformation of the healthcare diagnosis, procedures, services and supplies into universal medical alphanumeric codes.
Okay. What are the books you are using for coding?
3 books are used for coding. ICD-10 CM, that is International Classification of the Diseases, 10th Revision, Clinical Modifications. It is used to diagnose. It is used for the diagnosis and the disease conditions. And next is CPT. CPT is the current procedural terminology. It is used for the coding the procedures and the treatments. And next is the HCPCS. HCPCS is the Healthcare Common Procedural Coding System. It is used for coding the equipments and the supplies.
Explain the types of circulation.
There are 2 types of the circulation, pulmonary circulation and then systemic circulation. So systemic circulation, it takes place between the heart and the body systems. So the oxygenated blood from the heart is carried to the body systems, and then the deoxygenated blood from the body systems is carried to the heart. And next is the pulmonary circulation. So pulmonary circulation, it takes place between the heart and the lungs. So the deoxygenated blood from the heart is carried to the lungs, and then the oxygenated blood from the lungs it is carried to the heart.
What is keratoplasty?
Keratoplasty is the surgical repair of the cornea.
Explain what are carpal bones.
Carpal bones are also called as the wrist bones. So they are 8 in number. So they are the trapezium, trapezoid, triquetral, pisiform, scaphoid, lunate, capitate and hamate.
Define DVT.
DVT is deep vein thrombosis.
Explain about any system anatomy.
I'll explain about digestive system. Digestive system, it is also called as the gastrointestinal tract or alimentary canal. So the organs involved in the GI tract are mouth, pharynx, esophagus, stomach, small intestine, large intestine, rectum, anus. Mouth has teeth, tongue, palate, maxilla, mandible and uvula. The next part is commonly called as pharynx. It is also called as throat. So it connects the mouth and the esophagus. Next is esophagus. Esophagus, it is also called as the food pipe. It is a muscular tube. It is 10 inch long. It has 2 sphincters, that is upper esophageal sphincter and lower esophageal or cardiac sphincter. And next one is stomach. Stomach is a J-shaped organ. The parts of the stomach are fundus, body, antrum and pylorus. There are 3 layers of the stomach, that is mucosa, submucosa and muscularis. There will be small foldings in the stomach. It is called as a rugae, which help the stomach to expand when it is full, and the stomach also has the pyloric sphincter. And next is small intestine. Small intestine is also called as the entero. So small intestine, the parts are duodenum, jejunum and ileum.
Okay.
So
explain about pathological conditions from cardiovascular system.
angina pectoris, atrial fibrillation, arrhythmias, atrial flutter, myocardial infarction, cardiomyopathy, embolus.
What is hematopoiesis and where it will occur?
Hematopoiesis is the formation of the blood cells and it occurs in the bone marrow.
What are the parts of small intestine?
The parts of the small intestine are duodenum, jejunum and ileum.
Okay. What are stages of urine formation?
There are 3 stages in the urine formation: filtration, reabsorption and secretion.
What is the medical term for vagina?
The medical term for vagina is colpo.
What is the medical term for nail?
The medical term for nail is onycho.
What is asthma?
Asthma is a respiratory condition in which the bronchial walls constrict, where the patient will feel difficulty in breathing along with the shortness of breath associated with wheezing and coughing.
What is myringotomy?
Myringotomy is the incision into the middle ear.
What is myocardial infarction?
Myocardial infarction is a condition of permanent loss of the blood supply to the myocardial layer of the heart due to the blockage or occlusion of the coronary artery.
Okay. What is atrial fibrillation?
Atrial fibrillation is irregular heartbeat with irregular pattern.
Okay. What is volvulus?
Volvulus is a condition in which the bowel twists upon itself, causing obstruction.
What is immunoglobulins?
They are the large protein molecules that will act like antibodies.
What are cranial nerves and how many cranial nerves will be present in the body?
Cranial nerves belong to the PNS, that is peripheral nervous system. 12 pairs of cranial nerves will be.
What is corpus callosum?
Corpus callosum is present in the division between the two cerebral hemispheres of the brain.
What is pexy?
Pexy is a surgical fixation of any organ. Example is nephropexy.
What is ectomy?
Ectomy is a surgical removal of any organ. Example is mastectomy.
What is megaly?
Megaly means enlargement, so it is a suffix. For example, enlargement of the liver is called as the hepatomegaly.
What are the stages of delivery?
There are 3 stages of the delivery: dilation stage, expulsion stage, and then placental stage.
Okay. Explain about sepsis guidelines in ICD.
Sepsis is a circulatory infection. If a patient is diagnosed with sepsis, then the primary code will be the sepsis. If a patient is diagnosed with severe sepsis, then the primary code will be the sepsis and the secondary code will be the severe sepsis, and the additional code may be the organ system failure. If a patient is diagnosed with the septic shock, and the primary code will be the sepsis, secondary code will be the septic shock, and the additional code will be the organ system failure.
Okay. How you will code neoplasm?
Neoplasm, this table will be used for coding the cancers. So the table is classified as follows: malignant primary, malignant secondary, carcinoma in situ, benign, uncertain behavior, and unspecified behavior. So we will see according to which site the cancer is there, and we will assign the codes.
What are excludes? And explain about excludes 1 and excludes 2.
In exclude 1, both the conditions should be coded. In exclude 1, both the conditions should not be coded together. In exclude 2, if the document supports, we can code both the conditions.
Okay. How many sections will be there in CPT?
There will be 6 sections in the CPT. First one is evaluation and management, anesthesia, surgery, radiology, laboratory pathology, and medicine.
Okay. What is standalone code?
Standalone codes, it will have the complete description of the codes.
Okay, Avinya, you have performed very well. I will update you soon regarding interview status, and all the best for your career.
Thank you, ma'am.
Thank you.
You should have an in-depth start your career as a successful medical coder. Yes, I hope if you like this, share, comment and subscribe to our channel for more videos on medical coding. Thank you for watching.